Hello, everyone. This is Dr. Carrie Bedient with the Fertility Center of Las Vegas. Thank you for joining us for another episode of Fertility Docs Uncensored. I am joined by my two stunningly sensational, sexy co-hosts, Dr. Abby Eblen from Nashville Fertility Center.
Thanks, Carrie. Hey.
And Dr. Susan Hudson from Texas Fertility Center.
Hello, hello.
And we are joined again by Amy Beckley of Proov. She's a PhD pharmacist and is ridiculously smart on all sorts of nuanced components of the pharmacology of how we do all the testing that we do. So we do it all in the office, and she's figured out ways to do much of that at home. So, but we were just talking. So now that it's post holidays and everybody's had random gifts and all of those things, you had a Secret Santa gift that was extra special for you, Amy?
Yes. So last time you had me on, and thank you for having me again, we talked about how I'm an avid Pelotoner. And so I happened to get my Peloton on a Black Friday sale a couple years ago. And then randomly one day, there was this beautiful mug that just shows up at my house. And I was like, oh my God, it's my 2-year anniversary. And I've been writing almost every single day. Peloton must love me, that they're just going to send me stuff. So I go on social media and I'm posting about how amazing Peloton was and how awesome it was. So fast forward to, a couple weeks later, we had our Secret Santa event. And we go through and everyone's like, well, Amy, what'd you get? I'm like, I don't know. My Secret Santa forgot about me. And so one of my employees goes, actually, remember that mug 3 weeks ago? That was it. And I was like, oh my God, why didn't you tell me? You're like such an idiot.
You obviously loved it though.
Exactly. So that's how you know it's a good gift. If you're going to go on social media and like rant about it, it's great.
Well, I tell you, Peloton should have been thanking you because you gave them great publicity on social media.
Yeah,
they should have sent you another mug.
So is that your go-to coffee mug for every single day now?
Absolutely. This is actually, it's a great mug. It's very like thick. It holds enough coffee.
It's got a little curve to it, fits your hand.
Yeah, and then it's got the bring your spirit.
Yeah, I think it should be able to fit, underneath your Peloton like your water bottle does. I think it should be a coffee mug like that.
Yeah, I don't know if that's gonna fit.
That's fabulous. Okay, Susan, do we have any questions for today?
We do have a question. All right. Hi, I love your podcast. It helped me so much when I was trying to get pregnant with my first baby. Here's some background. In 2018, I had surgery to remove a uterine septum and was diagnosed with endometriosis. After a year of trying, they were referred to an RE at the end of 2020. All the tests came back normal, did 4 rounds of Medicaid IUI, and got pregnant on the 4th try. Their little boy was born March 3rd via emergency C-section. At 6-week appointment, they had an Eblen in place for birth control. OB felt it was the best option because it prevented periods and was going to help her endometriosis. Also recommended waiting 24 months before starting to try again after her C-section. I always want to follow my OB-GYN's advice because she's a great doctor and I trust her, but I worry about 2 things. In 2 years, I'll be 36, and I know age can affect fertility. Also, our RE is very close to retirement. It has medical issues of its own and will likely be retiring practice in 2 years. He is currently the only RE in the state that she lives in. The next closest would be 2 hours away and wouldn't be covered by my insurance since they're out of state. His office is trying to recruit a new RE, but has been unsuccessful. Should they wait the full 2 years or would be okay trying sooner, like at 12 or 18 months? What can I do in the meantime to preserve my fertility? When do we start trying? Should we start with the RE or trying on our own? So great questions.
Lots of questions.
Yeah. So what do you guys think?
So I think 24 months is a bit extreme unless
that's a long time.
It was an emergency C-section. So I'm wondering if she had to have a vertical incision on her uterus. With the exception of a vertical or teat incision, I think 12 months is usually adequate. Especially when we look at, advancing maternal age and the risks there. So I think in the absence of something that we don't know, most emergency C-sections are still going to be what we call a low transfer C-section. And as long as it was that type, I think that would probably be 12 months is probably adequate.
Yeah, you
So-
can also do a saline sonogram too to kind of evaluate that C-section scar, make sure it's healed well for sure. Sorry, go ahead, Carrie.
Oh, so I was going to say, I was lecturing about a month and a half ago to my residents, and I came in. So before we do lectures, there's oftentimes M&M, which is how residents and trainees and physicians learn about things that have gone wrong, and it's a literature review and it's a very educational thing. And so I came in at the end of that, and they were talking about the time length in between C-section to repeat C-section, or excuse me, from C-section to next conception. And I was always along the lines of, roughly 12 months is a good time to healing. And they actually sent me an article that was relatively recent that said 18 months is now standard. And so that is brand new information. And so it's something that
but what are the absolute the question is absolute risk versus relative risk put in the light of advancing age. I think that's something you'd have to look at, wouldn't you think, Carrie?
Absolutely. And it's something I'm trying to pull up the article, and it is buried deep within, I think it's actually within my my library files. So I need to go back and I'll see if I can pull that. But
the one other thing to think about for that patient, and I know this wouldn't necessarily be the route she'd want to go, but she could always go through IVF, retrieve eggs, make embryos, and freeze those. And I know she hadn't done IVF before, but that would also be potentially a way that she could sort of stop her time clock in a way by making embryos, and then 2 years later, whatever the time frame is, transfer those embryos at that point. Because it would be okay to do the egg retrieval. It just wouldn't be okay based on what our OBGYN is saying to get pregnant sooner than that.
Absolutely.
Yeah.
Absolutely.
Interesting.
And I would also, it sounds like you have insurance coverage where you are. Most of the time, if you ended up in a situation where you had absolutely no one in a certain reasonable geographic distance, they can do exceptions. I see these happen in Texas all the time, because even though it's a big state and we have a decent number of REs, a lot of us tend to be centered near big cities, and we got a lot of geography that's not close to big cities. So I have quite a few patients who come to see me, but they get exceptions because there's no one close to them. So looking into that, you might not be quite as in a deficit as and no one wants to drive 2 hours. I completely get that. But remember, telemedicine is now here to stay, hopefully. And so take advantage of that. And like I said, sometimes if you do have insurance coverage, you can get geographic exceptions if you don't have somebody near you.
It's a good point.
Yeah. Good point. Telemedicine's a beautiful thing.
Yeah.
And last question was, should she start trying on her own or go straight to her RE?
I think time's getting kind of close. I would at least talk to an RE first and get some advice from them.
I mean, I don't think there's any harm in trying in the interim. I just would be aware of the time trap that is true for all of our patients of I'm just going to try one more month and just one more month and just one more month. And 3 years later, here we are with a bigger issue when all of a sudden you're 36, 37, and we're seeing more issues with timing. But I think just the inherent trying on your own isn't a problem, but I would do multiple things at the same time.
Yes, I agree.
All right.
All right.
So today we were going to talk about an issue that's one of the more frustrating ones that all of us deal with, which is recurrent pregnancy loss. And Amy, you had mentioned the last time we were talking about you have a really pretty extensive history of losses. What happened and how did things go? And what's that background?
Yeah, I've had 7. Has not been a particularly fun journey, but because of what I invented and what I built after it, it makes what I went through meaningful.
Yes, absolutely.
Yeah, so I was 28, newly married, started my postdoc after my PhD, was starting to build a career, bought that nice house in the nice neighborhood, researched the schools. I was like, I'm totally going to get pregnant. It's great. Tried about 6 months, about 7 or 8 months into it, got my first pregnancy test, positive pregnancy test. It was on Mother's Day.
Aw.
Actually a few days before Mother's Day, and I was just over the moon excited. It was just wonderful. And then on Mother's Day, I started bleeding. And
Oh,
I
That's the
felt,
suckiest period ever.
I
Yeah.
know. I was like, you've got to be kidding me. But then I felt like, okay, well, this is the silver lining that at least now I can go to a doctor, because typically that you're trying for 12 months by yourself, because I was under 35. And this was kind of increase the time clocked. I'm like, okay, at least I can go in and like ask them what's wrong with me. And so I went in and I said I had this pregnancy loss, and they said, well, it's just normal. 1 out of 4 pregnancies end in loss. It just happens. There's really nothing we can do about it. Just go back home, and let us, know the next time you're pregnant, and, and call for an appointment. So I said, okay, okay. I really didn't know how to act other than, okay, I guess I'm at this alone. But it is true, most pregnancy losses are unavoidable. They're mostly genetic. Something happens, sperm and egg, and it doesn't work out. And most of the time you go on to have a successful pregnancy the next time. And so the next time came, and I got a positive pregnancy test, and I was a little reserved at this point, but kind of excited. And, I take them, one after another, make sure it was positive. Was the line getting darker? Like anything I could possibly do, because they don't want to see you until you're like 6.5 weeks along. Or I think it's like almost 8 weeks now. And so I was like, okay, I'm just going to like try to not stress out and just kind of like sit around and not do anything crazy, because I thought, maybe something I was doing was cause the loss. But again, I lost it. And then again, I called the OB office and I told them this was my second loss. And they said, well, if you have a third one, then call us. We'll do some testing. There's really nothing we can do here. And I felt very hopeless, just very alone, and just like I didn't have any answers. And so then we hit the 12-month mark. We went to an RE. And in the care of an RE, I got some additional testing. Everything turned out normal. I didn't have any clotting factors. I didn't have any other, issues. Everything was fine. And then I have another loss, and then another loss. And then finally, we just decided to do IVF, because I just did not want any more losses. I didn't want to wait any longer. And that was successful. So I have a 12-year-old IVF baby.
Yay.
But I'm a scientist. I study hormones, and I was just very frustrated with the idea that women didn't have anything that they could do while they were waiting. And we always internalize it as it's something I did. I had sex while I was pregnant, and that must have dislodged it, or I ate that turkey lunch meat. It must have caused the loss. I went to Vegas after having a positive pregnancy test. It was a girls' trip, and I had tonic water, no alcohol, none at all, tonic water. And then I had a loss, and I'm madly Googling, and it turns out like the compound in tonic water sometimes leads to loss. And I'm like, okay, that's what caused my loss, right? And so it's like you think
want to blame somebody.
Exactly. And so after I had my son, I went in, I was like, I'm going to figure this out. So I already told this story in the other one, so I'm not going to go into it again. But basically, it turned out to be a low progesterone issue after ovulation. And I got pregnant naturally, but with luteal phase progesterone to allow me to finally have a child without a loss. That was not an IVF baby. And so, I invented Proov, because Proov is a testing system to help you understand if things are okay. So it's a screening tool. So just like you would do an STD screening, you also want to screen for your hormones to make sure everything's okay. And it's just something you can do to like check the box and say, okay, everything looks good. Because what I did find out is that while 75% of pregnancies are unavoidable, it is genetic, it is sperm and egg didn't meet. There's about 25% of them that are what I call preventable. And those are things that you can prevent. One of them being, hormone issues. So if you have a underactive thyroid, it's really hard to make progesterone. It's really hard for your ovaries to function. So something that women could do is get their thyroid tested. I mean, Everlywell, all these companies have these at-home tests. If you don't have a physician, go get your thyroid levels checked. You can go to Quest directly and go get a lab draw. It makes it really convenient. The other one is progesterone. So if you don't have enough progesterone to support pregnancy, so get your progesterone levels checked. Another one is infection. So they also have STD panels. There's a big thing with like vaginal microbiome, and sometimes some of the microbes that are present in the vaginal canal can lead to higher miscarriage rates. There's also structural issues in the uterus that can be removed, right? That's needs a physician, obviously, to do. But just kind of educating women to be a little more proactive, because we have a lot of consumers that come to us, a lot of women that are just, they're hopeless and they're lost, and they think the loss is their fault. And just empowering women with things that they can do to be proactive, and education about, it is common, but sometimes there is something you can do to prevent another loss, and just to have those better questions.
And as we mentioned earlier, your kit Proov can check for a lot of those things, correct? So estrogen and progesterone and FSH. And one question I had about the progesterone, because certainly, we know that can contribute to miscarriage. If a woman does a kit, say this month, what are the chances that if she does it the next month and the month after that, she'll get the same result? What's the cycle to cycle variability with things like progesterone, for example?
That's a really good question, and I don't know that answer. But typically, if you have 2 good cycles, you can kind of cross it off the list as like, I probably most likely don't have an ovulatory issue. But when you have a bad, like a bad cycle where you're not producing enough PDG, which is a progesterone metabolite, in urine across, when implantation occurs, then you could be at higher risk for having ovulatory issues that need treatment. But like things like diet and exercise and stress really impacts it. I know we're coming off of COVID. COVID had a huge impact on women's cycles. And we would see very low estrogen and very low progesterone levels 1 or 2 cycles after. And so there can be things where you had a stressful loss, or maybe you just had a miscarriage and your body needs a cycle or 2 to kind of get back into the swing of ovulating again. Or maybe you just got off birth control. Your body needs to remember how to ovulate and make these hormones. That we do see that women will have a low score, meaning they didn't ovulate very well or not at all. And then it turns better. We do see, diet and exercise can actually affect that. Getting put on a really good prenatal can actually help improve scores. Cleaning up diet, eating kind of more clean, taking out a lot of the sugars, that can help as well. If you have PCOS, doing inositols is really helpful as well.
One thing I'd like to mention, you mentioned about coming off of birth control pills. Just for our listeners, if you're on birth control pills and you are coming off, though, realize that there's also some good data that says your highest chances of getting pregnant are in those first like 3 months. And so at the time that you're the least predictable, you're also potentially the most fertile. And so don't, it's one of those situations where you could have some issues, but also know that if you're getting off, there is a very real possibility that you could get pregnant. So don't be like, oh, well, we really want to get pregnant in 3 months from now, so I'm going to stop them now so that I'm because we have a trip planned and I don't want anything to happen in the next 3 months. That's probably not a great timing scenario.
That is so true. One thing I've learned with studying women's cycle is there is no normal. Like it's crazy. There's some women that are super fertile and there's some women that aren't after birth control. Like there's no like hard and true facts.
It'd be interesting kind of seeing how like taking just because this is neat because you can do it at home so you don't have to worry about getting sick. And one thing that we've seen over the past couple of years is kind of menstrual cycle irregularity from people getting COVID. and how that plays into it. And potentially I'm giving you a research idea here. So, but using like Proov in like the first 6 months after a COVID infection to really kind of see what kind of hormonal changes
Yeah, that'd be really interesting.
And you don't have to worry about people getting infected and stuff from, going in that time frame. So just an idea.
Yeah. Yeah. I mean, so I had COVID a year, 14 months ago, and I was tracking my cycle. And then we had a bunch of women that were tracking their cycle, and the patterns we saw were elevated FSH at the beginning. So typically my FSH levels are about an 8 or a 9. I'm 42. But the cycle after I had COVID, it was an 18. Yeah. And we just kept getting women reporting really high FSH levels, that we started asking the question, did you recently have COVID? And a lot of them were like, yes, or like, no, but I had a really bad cold. I was like, oh, okay. And so what
did you happen to not swab your nose?
Yeah. Yeah. What I think was happening was your body basically releases FSH to say, so the ovaries basically shut down and saying, hey, we're sick. We have to heal. This is not a good time to get pregnant. And so your ovary just becomes somehow, I don't know how, becomes unresponsive. And so your body has more FSH to kick the ovaries into gear. And then when you do ovulate that cycle, it takes longer to ovulate. And then your hormones are also much lower that cycle. And so I think it's just nature's mechanism of saying, you know what, you are not healthy right now. We need to heal first before we can make a house for baby.
It's fascinating. I wonder if there's more twins after COVID, because when you have a higher FSH level, you're more likely to get multiple follicles.
Yeah, that's that'd be a good study too.
These random questions. So Amy, how did you mentally and emotionally survive? Because 7 miscarriages, I mean, we have people who they hit 2 and they're like, I'm done. I'm not going to try. I'm over it. And to keep going after all of those losses, what did you do and how did you get through to keep going?
I don't know. I absolutely had my moments where I was in the fetal position and my husband was spooning me and he was telling me, okay, we just won't have kids, and which actually made it worse, right?
Yeah.
They're trying to be what you want to hear. That they can. I will support you, but like, you're like, no. But I think it was my scientific mind where it was like, I refuse to fail. Like I know there's a reason why I can't keep this pregnancy, and I will not stop until I figure this out. So yes, it was very emotionally draining and just so hard. But the idea of trying to figure out what it was and getting to that end result, like I wasn't going to stop. I wasn't going to let this beat me. I was going to beat it. And so just kind of, you have to have your day, you have to have your ice cream and your cry session and your partner by your side. You gotta have that. But then you got to be like, you know what, this isn't my lot in life. I refuse to let this be my fate. I'm going to try something else. Right. And so that's why I was, excessively Googling and researching and thinking about different things and having conversations with my doctors and not refusing. And so, that's what I advocate to all of our users right now is like, you're the expert in you. Your doctor is the expert in medicine. And when you can have that conversation together where you talk about your experiences and their medical expertise, that's where you're going to get to the solution the fastest. So the better, more detailed history that you have of yourself, the better chance you're going to resolve your issue in a positive way.
Were you talking to anyone else besides, I mean, obviously your husband, obviously your RE, but did you have any outside besides those 2 people, support and cheerleaders and all of that throughout this?
Not officially. I had, I was like, I don't even know what my name was, like TTC Bunny 21 or something weird like that, where I would go on these like private forums and I would post, and you build these relationships with these random women that you don't know, but you don't want to tell your mother and you don't want to tell your friends, like you're in this closet. But having these online forums where you create friends and you create people that are going through it was, one of my saving graces, because I had an outlet. And that's why we have a really big community at Proov, where we do it through Instagram and Facebook. Facebook, you have to put your name on there, but Instagram, you don't. And so we offer support to women when they need it, when we know that we might be the only lines of communication this woman has, to help educate her about different things. Because it is very isolating. I mean, I went through it and I felt so low, and just, how could I be a woman if I couldn't have kids? Like, it sounds crazy, but it's like that maternal instinct like kicks in, and you're like, I'm nothing if I can't have kids. And you don't want to talk to anybody. You don't want to do anything. And you always think about fertility. Every single time you go to the bathroom, you're looking at your toilet paper. Am I spotting? Is it fertile cervical mucus?
Yeah.
Like, you can't, get it out of your mind. And so, yeah, these online forums were so amazing. And actually, I have legitimate friends now that I met through the process.
Oh, that's neat.
Yeah, it's great.
What did your husband do? I mean, he had the RE as well, but what was his outlet?
He would talk to his dad about it, which I didn't know until actually afterwards. But it was more hard on him than I thought it was.
Yeah.
And so I remember having a really, really traumatic loss, and thinking, because we had seen the heartbeat, we were like, okay, this is great. And we had the ultrasound picture and we framed it. We gave it to grandma and grandpa. And then like literally the next day, I started bleeding, like not even kidding, like literally the next day. And so I went into the ER, and it was like, we were on vacation at the time, so I wasn't at home. Went to the ER, didn't find a heartbeat. And I was like, oh my gosh. And that was so emotional, because I had told people now.
Yeah.
Right? And I thought I was safe, because I saw the heartbeat, like I was safe. Right. And it was hard on him to see me like that. And so he would just say, oh, well, we're not going to do this anymore. Like, we're just going to stop, because it's so hard on you. And which, he was trying to do the best he could, but it was
trying to protect
very
you.
hard on me. Because I was like, no, I just need my weeks of grieving time. Like, please, this is not the end of our story. Like,
Yeah.
I think it's important for our listeners to know realize that you and your partner are both grieving, just as you described, but also know that you may not be at the same stage of grieving as your partner. And it's okay for one person to not necessarily be in sync with the other person, but know that you both are really going through this process together.
Yeah. I mean, they've done scientific studies where they look at different diagnosis and the mental impact that it has on people. Miscarriage and infertility are up there with cancer and HIV. Like, it's big. Like, it is emotionally one of the worst news.
Yeah, those are studies done by Ali Domar in Boston. Those are some great studies. I think it really validates women's feelings, because when I tell patients about that, they're like, wow, you mean people that have recurrent cancer have the same, symptoms that I have? And they do.
Yeah,
absolutely. Did you take any additional medications besides progesterone, or did you think about anything additional? You had mentioned you had a bunch of the clotting studies, and part of the reason we do that is trying to figure out, is someone an appropriate candidate for Lovenox or not, which is a blood thinner. But did you look into any other potential, just empiric, meaning no data, but we think this might work, kind of medications?
Yeah. People ask me this all the time. I actually did low dose aspirin. Also, dexamethasone is another one, like a really low dose dexamethasone. But I did low dose aspirin myself. You can get it, anywhere that sells medications. And I took that, beginning of my cycle all the way until about 35 weeks or so, because they said if I had a C-section that I wouldn't need to be off of blood thinners for a while. But I remember having conversations with RE, and he was like, you don't need it. All your testing's fine. And then going in the literature and just looking at the data, and it never hurt anything. And if anything, it sometimes had a benefit. And so I just said, you know what, I want to have my best chance possible. And so I took it. I don't know if it helped or not, but it was definitely not prescribed to me.
Yeah. I think all three of us have had that experience where the data behind using aspirin is, it's not really great, but it's such a low harm impact that many people do it. And when you look at the timing, a lot of us will say don't take it until after you've ovulated so that it doesn't accidentally interfere with ovulation, because NSAIDs, whether that's aspirin or ibuprofen or any of that family of medication, can potentially interfere with that. But I think we've got a lot of people on that and on progesterone just as empiric treatment of, hey, let's see if it works.
Yeah,
So
that's another one that's a good solid tip of what not to do. So don't take Advil, ibuprofen, which is like my drug of choice for pain.
Yep.
Anytime after your period, like as soon as your period stops, you just stop taking it the rest of your cycle. Just don't do it.
Yep.
Because it will interfere with ovulation. So you need some of those inflammatory markers to actually ovulate. And so by taking
if you happen to be
ibuprofen,
somebody who has some significant middle schmerz, adopt some Tylenol.
yeah, exactly. Yeah. And I didn't know that because everyone, sometimes they get bloating with ovulation. They're like, oh, I'm just going to take some Advil. Don't do it.
Yeah. All right. Well, thank you so much, Amy. We are very appreciative of you coming in and sharing not only all of your scientific background and all of the work you've done and helping people track hormone levels and getting from information point 0 to information point 85, but also some of your personal experience, because so many of our listeners they really struggle in thinking, oh my gosh, I'm the only one, and I'm the only one who's having losses, and I'm the only one who's not getting pregnant. And that is very much not the case. And so it's so helpful to hear from other people of, yep, you can do it. Take a deep breath, have your ice cream, curl in the fetal position, and keep going.
But then get back up.
Yes. So thank you. We are very appreciative of you coming on and talking to us and walking us through a lot of this data, as well as a lot of the life part that goes with it.
Yeah, I'm happy to. I mean, this is everything that we believe in at Proov. We're just 15 women on a mission to help women get pregnant and try to create the best resources and education that we can.
That's awesome.
Wonderful.
Thank you.
All right. Now, to our listeners, thank you so much for listening. Be sure to tune in next week for more. Be sure to subscribe, leave us a review in Apple Podcasts. We love to hear from you. We're on Instagram, we're on Facebook, we're on YouTube. Stop by, say hello, send us pictures, tell us your stories, all of the things.
And you can also visit us on fertility.suncensored.com to submit specific questions. All questions will be answered on the podcast for our Ask the Doc segment. We'd also love to hear episode ideas. So let us know what you want to hear.
As always, this podcast is intended for entertainment and is not a substitute for medical advice from your own physician. All right. We'll see you soon. Bye.
Bye, everybody.